In a three-part hematology system, the blood cells are all counted and assessed using impedance technology and are then displayed in three separate histograms: platelets, red blood cells, and white blood cells. Red blood cells are defined as the cells between the set lower and upper discriminators, where the x-axis represents the size of the cells in femtoliters, and the y-axis represents the number of cells. The mean cell volume, denoted as MCV, is calculated from the area under the peak. MCV equals the sum of the size of all counted RBC pulses divided by the number of RBC pulses. MCV represents the average size of the red blood cells. The red cell distribution width, RDW, is a parameter that shows the variation in cell size for the red blood cells. If the red blood cells are of similar size, the RDW will be low. If the cells vary in size, the RDW will be high. The RDW is presented as RDW absolute, which is the calculated absolute width of the red cell population. It is also presented as RDW percent, which is the RDW normalized for the cell size. Pulses that are counted in the far left of the curve can indicate giant platelets, platelet clumping, or electrical interferences. Pulses that are counted in the tail of the curve can indicate overly large cells, agglutination, or rouleaus. The normal curve should show a Gaussian distribution around 90 femtoliters, where both discriminators touch the baseline. If there are many small red blood cells present, the curve will shift toward the left. If there are many big red blood cells present, the curve will shift toward the right. If the curve does not start from the baseline, there will be an abnormal high at the low discriminator. This could have several possible causes, such as cell fragments from red or white blood cells, large platelets, also called giant platelets, small red blood cells, also called micro-RBC, platelet clumps. The reason for the abnormal high at the lower discriminator is that the analyzer is unable to differentiate in between these cells, fragments, and complexes, as they are very similar in size, and the populations therefore merge. If this occurs, the instrument may flag for abnormality in HCT, MCV, MCH, or MCHC. Check for platelet clumps. If they are found, take a new sample and analyze again. If the curve does not end at the baseline, there will be an abnormal high at the upper discriminator. This could have several possible causes, such as red blood cell agglutination, cold agglutination, nucleated red blood cells, small lymphocytes. The reason for the abnormal high at the upper discriminator is that the analyzer is unable to differentiate in between these cells and complexes, as they are very similar in size, and the populations therefore merge. If agglutination occurs, the instrument may show a low incorrect RBC count, and the instrument may flag for abnormalities in HGB, MCV, MCH, or MCHC. Check for agglutination in smear, and rule out cold agglutination by warming the sample to 37 degrees Celsius and rerun. If the curve displays multiple peaks, this is an indication that there are more than one population of red blood cells in the sample. This could have several possible causes, such as a patient recovering from iron deficiency, a recent blood transfusion, dual deficiency anemia. The reason for the two peaks is extreme anisocytosis showing varying size in the red blood cell population. If this occurs, the instrument may show flagging of RBC, MCV, and RDW. Proceed to confirm the dimorphic populations in smear.